Hello world, my name is Christina Kren, a webinar intern at onehealthlessons.com. Today I have the privilege to talk with Joshua Twinomujuni from Uganda. Hello Joshua, how are you doing today?
I'm doing fine, Madam Christina Crane. First of all, I would like to appreciate how you pronounced my name, Joshua Twinomujuni. So I like it, the way you said it. So once again, I'm Joshua Twinomujuni, a student at Makerere University, pursuing Bachelor of Arts in Economics. And I happen to be the researcher of Makerere University Economic Society. The society is specifically for the economic students, and it helps them to connect with other economic students from different universities. And
Very interesting.
I also happen to be the co-founder of Jomas Foundation Africa, and Jomas is.
You said Jomas Foundation of Africa. Um, well, basically, I would like to know Uh, what are the activities of your organization when the organization was founded, and how did you came up with the idea to create such an organization? Basically, what were the reasons or motivations behind that idea?
First of all, I would like to first introduce Jomas Foundation Africa to do so that to elaborate it more. Jomas is Join Me Save Africa. It's a youth-led non-government organization in Uganda that works with children, women, and the youth. I am the youth, and I also happy to be the youth. And one of my interests and motivation is to be a youth advocate and a youth change agent. And first of all, before I proceed on what we do as Jomas, I would like to say kudos, or I would like to thank these people that have made Jomas happen. First of all, I would first consider our members. It's Jomas Foundation Africa is an organization of 10 members who have made this happen. You know, there are different categories for you to be a non-profit in Uganda. You have to pass through legal issues, go this office and this office, so that you can be registered and they become legal and officially become legal and begin operating. So I would like to first thank our members who have made everything everything happen for Jomas to exist, and also thank our advisors and mobilizers, and that is Dr. Catherine Bide. She's a lecturer at Makerere University College of Business and Management Sciences. And then I will also thank Dr. Jovita Katsine. She's also a lecturer at Makerere University. Then Madame Gabriano Bone. She's a nun at the Catholic community in Bugolobi. And also, I can't also forget to thank Dr. Abio Brenda. She's a physician from Mulago Hospital. I don't know if you've ever heard of Mulago Hospital.
No,
Then
I haven't.
I would also like to thank Madam or Professor Corey Jane Hyde. She's also a professor and a lecturer in a certain university in USA called Gabi Alliance University. So those people have made Jomas happen to what it is now. And we are happy for them. And there's no way I couldn't thank them. And I would also like to thank you uh, who have given me a chance to thank these people. And
You're welcome.
proceeding to what we do as Jomas, as I said before, we are working with target groups of children, youth, and the women. On the side of children and the youth, we are working on programs of addressing issues of sexual reproductive health and rights, plus gender-based violence. But just the gender-based violence is more of women. We sensitize the women uh, on different programs of gender. Then on the side of the youth and children, desensitize them, give them the sexual related information so that the children and the youth can make informed choices of their lives. So that's all about Jomas and what we do.
Excellent. I was wondering, from one side, basically about the activities that you're pursuing in teaching the learning material actually of One Health lessons. I would like to know, for instance, what was the reaction of the students of the community where you live regarding um, the whole concept of One Health, and what is, according to you, the future of One Health, and how your organization will um, promote One Health.
Simply, One Health is a multi-sector and transdisciplinary approach working at the local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between plants, animals, and the people. So, uh, between people, plants, and the environment, sharing or working together to achieve the same common goal of One Health. So that's basically about One Health. Then, so now regarding to One Health lessons, Jomas is willing to work with you on the sectors of people's health, people's One Health, considering children as our target groups and the youth. So that's how we have organized our activities regarding Jomas Foundation Africa and One Health Lessons. And we are also thrilled and humbled and take the honor and opportunity to work with you the sectors of people's health or people's One Health. Thank you.
You're welcome. Thank you for responding this question in a brief way. I would like to know more about the activities that your organization is pursuing in terms of the impact that it has on the local community. As I said, you started teaching the One Health lessons prepared by Dr. Deborah Thompson. What was the reaction of the children once again, and how will you relate that to the future of One Health? That was basically more the content of my question in terms of what are the future goals of your organization in terms of the promotion of One Health.
Yeah, thank you. You really ask good questions, and really thank you for that.
You're welcome.
So, and that's what I've been waiting for. I think I have not yet elaborated more of it. So, regarding to the future of One Health Lessons and Jomas Foundation Africa, we have designed programs, different programs on One Health, whereby we shall be going to different communities and institutions or schools, teaching the children about One Health and how they can sustain their lives and how they can maintain proper health of their lives. So, with the previous discussion with Dr. Deborah Thompson, we discussed more issues about children nutrition. And what I discussed with her, I told her that in Uganda here, uh, children carry 49.4% of the population. And that really shows you the power the children have. And these have been our most target groups because they carry the most percentage. And and for a child in Uganda to be called so, he or she has to be below the age of 12. Then from 13 to 17, that is maybe a mature child who can also decide for himself or herself. But for us, our focus or our target group is children below the age of 12 years. We shall be reaching out to them by going to institutions and going to community. So That's all about what we have designed for with One Health lessons and what we have discussed. Then on the case of child nutrition, in Uganda here, what we have discovered, most children here in Uganda are facing problems of stunted growth. I don't know if you know
Yes,
stunted growth.
yes.
So this has been an issue due to
Water
poor
scarcity,
feeding.
maybe? Water scarcity, food scarcity
Yeah,
as well.
food scarcity, poor feeding, and maybe capital incapacitation of the parents. So, and this has come at a rampant stage whereby it has now become rampant and unavoidable due to the effect of COVID-19 coronavirus. So we have designed programs whereby we shall be going to communities to discuss with the parents or the mothers how to feed the children and how to properly feed the children and breastfeed the young children, and so that we can try to embark on that issue. Then for the case of the children who are schooling or who are in school, we shall be finding them in their own schools, discuss with them how to wash hands, how to eat well properly, how to organize themselves in terms of health issues. So that's how we have designed our program with One Health Lessons.
Impressive. Indeed, the programs will help a lot the children community in Uganda, I believe so. And what is most important is that children nutrition, it is one of the problematic issues in many countries in the world, such as Africa, India, some parts of the Balkan countries as well where I live, and etc. etc. For instance, in my country, regarding the aspect of children nutrition, there are some legal policies regarding the that schools actually should implement. For instance, schools are obliged to prepare food 3 times a day while the kids are at school. But this generally happens in private schools, not in public schools. Therefore, the aspect of children nutrition in my country, it is not very developed because basically children need to bring their own food from home to eat it at school during the um, break period that lasts generally no more than 10 minutes, which is not healthy either. So
Mm.
basically, we are as children we were running between classes and the necessity to have a proper nutrition habits. Therefore, I was wondering what is the situation of Uganda regarding the school organization in terms of the policies of the canteens that are in the schools, how that works. What can you tell us about that?
So the current situation of schools in Uganda, we are under COVID-19. So the schools were closed in late March. They have not yet been opened, but they allowed different sectors, the candidates, that is senior 4, senior 6, and the university maybe the finalists.
Okay.
But for the case of the institutions, the education institutions have not been formally opened in Uganda, but we hope that they are going to be opened in early February. That's when all the schools are going to be formally opened and begin operating and educating.
And what was the situation before the emergence of COVID-19? What was the food policy regarding the children nutrition in the schools of Uganda?
So, for the case of institutions and children in schools, uh, institutions here in Uganda, we have two different types of institutions. We have the public institutions or government institutions, then we have the private institutions. Uh, Government or private public institutions have their own policies and how they do their things and their activities. For the case of feeding, public and government institutions are more elaborated and more nice than private because they mind more about their children and their population than private schools. So our focus mostly we are going to be tackling on private schools because the policies of feeding the children are so weak, are still weak. So that's where Jomas is going to tackle more private schools. And we are going to be focusing more on in areas of Kampala. I don't know if you ever heard of
Yes,
Kampala.
Kampala.
Uh,
I could have the opportunity to interview many members from the community of the university community of Makerere University. So therefore, I heard a lot about Kampala.
So we are going to be addressing different issues on the children's health. Regarding with One Health Lessons, I will be working with Jonathan. I don't know if you know Jonathan of
Yes,
an
I
intern at Mackay
heard of.
University.
Yes,
So I'll be working with him, going to different institutions in early March or late February when institutions will be stable enough to begin operating, and we shall be going together different communities and different schools. As the progress photos we shall be taking, we shall be sharing with you, and you see our work. And we hope this activity could be possible, and we work with you. We are really happy with you.
excellent. Well, best of luck for the future activities of the Jomas Foundation. I truly hope that the policies and the activities that you undertake will increase the quality of basically of the school performance regarding the proper children nutrition. I mean, providing proper children nutrition. Therefore, I would like to thank you a lot for your time and for giving us the opportunity to hear more about your foundation. Um, I wish you all the best as well, and talk to you soon.
Okay, before I conclude, I wanted to pass through this information. No, I wouldn't be doing my job if I did not end this with an appeal.
Of course.
As Jomas Foundation Africa, we have been reaching out to supporters, friends like you, and we have been asking you to join us and make impact according to our emergency plan
Yes.
appeal. As we thank those who have responded to us, and we really delighted because you make our life and our work possible. But we cannot do this without you, and we invite you to support us in every way. And my email and phone numbers are shared with you, and we hope to communicate together. And if you have any question, you ask me, I will be ready to answer. And that's all about it.
Excellent.
Also,
Excellent.
thank you for everything you've done for me.
You're welcome. We are going to share the information about the Jamas Foundation in the description part of the YouTube video, basically. And yes, thank you a lot once again. Bye bye.
Bye.